Well, as far as the immunology, what happened, these patients got immune paralysis, so the immune system in patients with acute and chronic liver failure, their immune system is more overwhelmed for a massive inflammatory response. And the immune system is basically paralyzed. There's some effects on the mitochondria that we see that they are not as effective as patients without ACLF. So I guess one of the things that we ought to do is look at the white blood cell count with differential and look at the presence of increased white blood cell count. The other thing that we can look is to look at the C-reactive protein, and then in the, investigational setting, we can do the interleukin 6, 8, and a few others. So I think that regardless of the definition, both definitions are pinpointing that these are critically sick patients with chronic liver disease or cirrhosis. So the idea is to look at the white blood cell count, same parameters, make sure there's nothing wrong with them as far as infection or bacterial or fungal. And after applying either or criteria, then the idea is to treat them quickly, as we discussed here in the liver meeting. So from Asia, and in particular for India, there have been data on the use of granulocyte colonially stimulating factor, GCSF, that has been proven not valid in the US. There have some randomized clinical trials and meta-analyses that were not that effective. So that would be an idea to get out the stem cells to be more effective, but to this day that's not proven to be clinically efficacious. So I think that goes back to my prior comment, is GCSF could have been used, and actually have been used in Asia, in India, for instance. But in the US, the trial didn't succeed. Plasmapheresis or plasma exchange can help a little bit in some patients, but it's not a long-term solution. And then the other thing is albumin exchange also can help, because the albumin has some immunomodulatory effects. As far as diet, unfortunately, I don't know much about it. I know that there might be some dietary modulatory effects to improve the immunomodulation of diet. But all in all, to this day, as far as the immunomodulatory effects, there is nothing strong to completely recommend the use of that.